Okay, Assalamu alaikum. So today we will discuss about the TOG article regarding the male infertility. So what history question you ask for the male infertility? Okay, you will take the developmental history and you will ask about the puberty, testicular descent, change in the shaving frequency, loss of the body hair, any infection like the history of the mom, sexually transmitted disease, prostatitis, and the sinopulmonary symptoms. You will take the history of the surgery, vasectomy, hernia, hydrocele, and the varicocele repair. You will take the drug history and the environmental history. You will take the history of the alcohol, smoking, anabolic steroid, chemo, radio, prolactinoma, hyperprolactinoma, exposure to the toxic chemical, radiation, recreational drug, sexual history, libido, frequency of the intercourse, and the previous fertility assessment, any chronic medical illness. So these are the history question you can ask from the for the male infertility. ठीक है? Okay, after the history, what you will do the journal examination. So in journal examinations, you will first of all you will check the BMI and increase body fat and decrease muscle mass. You will check the body fat and the muscle mass. If there is increased body fat and decreased muscle mass, it means there is the androgen deficiency. Okay, so you will check the skin for the loss of the pubic hair, axillary hair, and the facial hair, and decrease oiliness of the skin and the fine facial wrinkling. It means there is a long standing androgen deficiency. After that, you will examine the external genitalia. Examination of these scrotums can reveal the absence of the vas deferens epididymis and the enlargement of the enlargement are the varicocele. Decreased testicular sizes cells by the experienced are by the Prader orchidometer, and the testicular volume is below the 15 ml is considered the small. Look for the hernia and you will assess the breast examinations to exclude the gynecomastia. It means if there is a gynecomastia, it means there is an increased level of the estrogen. Incomplete sexual development can be recognized by examining the phallus and the testis. So यू विल डू दी जर्नल एग्जाम फिजिकल एग्जामिनेशन. सबसे पहले आप क्या देखेंगे, उसका बॉडी मास देखेंगे. ठीक है, अगर थिन लीन है और बॉडी जो मसल मास है उसका डिक्रीज़ है तो इट मीन्स देयर इज़ अ एंड्रोजन डेफिशिएंसी. और अगर एंड्रोजन डेफिशिएंसी होगी तो प्यूबिक और एक्सिलरी और फेशियल हेयर भी कम होंगे. ठीक है, और ऑयलनेस ऑफ दी स्किन्स वो भी कम होगी और फेशियल रिंकलिंग होगी. सो ऑल दीज सजेस्टेड डेट देयर इज़ द एंड्रोजन डेफिशिएंसी. ओके, उसके बाद आप एक्सटर्नल जेनेटेलिया देखेंगे, स्कोटम देखेंगे, हर्निया के लिए उसे असेस करेंगे और टेस्टिकुलर साइज मेयर करेंगे. ठीक है, अगर टेस्टिकुलर वॉल्यूम मेयर करेंगे. ठीक है, अगर वो 15 से कम है तो इट मीन्स देयर इज़ अ स्मॉल टेस्टिस. ठीक है, और गायनिकोमेशिया के लिए ब्रेस्ट एग्जामिनेशन करेंगे और सेकेंडरी सेक्शुअल कैरेक्टर्स और सेक्शुअल डेवलपमेंट के लिए हम फेलस और टेस्टिस देखेंगे. ठीक है, अच्छा, उसके बाद आफ्टर टेकिंग द हिस्ट्री इन द एग्जामिनेशंस देन यू विल डू दी इन्वेस्टिगेट. सो व्हाट आर द इन्वेस्टिगेशन? फर्स्ट ऑफ ऑल यू विल डू दी semen analysis. We already discussed the WHO criteria regarding the semen analysis parameter, and if there is the less than the 5 million spermatozoa, then it is called that it has the severe oligozoospermia or the azoospermia. So in this case, either you will repeat the semen analysis as soon as possible, or you will do the serum FSH, LH, prolactin, and testosterone and estradiol level. Okay. So how will you diagnose that it is the pre-testicular cause or the testicular or the post-testicular? So when there is a FSH and testosterone are both low, so it means that is the pre-testicular cause. And when there is the FSH is high but the testosterone is low, then it means the testicular cause. And FSH normal and testosterone both are normal, it means post-testicular. If the male is taking the anabolic steroid in which he has the FSH low and the testosterone high, normal or low depend on the drugs. If the FSH, LH, testosterone are normal, okay, if you will if there is a severe oligozoospermia or the azoospermia, okay, then you will repeat in the semen analysis and you will do the FSH, LH and the testosterone. So all these report are normal, but still he has the oligozoospermia or the azoospermia. Then what you will do? Then you will do the post-ejaculatory urine sample that provide the evidence about the possibility of the retrograde ejaculation. Okay, so treatment options. We already discussed in the hypogonadotropic hypogonadism, you will give the GnRH. And surgery, the reversal of the vasectomy and the surgical sperm recovery. Surgical sperm recovery is done by the testicular sperm extractions or the microsurgical epididymis and the microsurgical and the percutaneous sperm extraction. Okay, success rate of the sperm retrieval is the 100% cases in the obstructive cases and the 50% in the non-obstructive cases. Okay, the monthly success rate of the IUI is the 8 to 16%. That is the very important, and the IVF and the ICSI 33% per embryo transfer. Okay. So retrograde ejaculations due to the surgery. What are the causes? It may be due to the surgery, autonomic or the pelvic injury, and bladder neck injury or the certain medication just like the alpha antagonists. So what is the treatment of the retrograde ejaculation? That is the alpha agonists such as the pseudoephedrine that restore the antegrade ejaculation. Okay, so retrograde ejaculation can be treated with the IUI using the male partner spermatozoa collected after the alkalinizations of the urine and washing the sperms. Alternatively, the spermatozoa can be used for the IVF or ICSI. So, for treatment of the retrograde ejaculation is the IUI or IVF or ICSI after the sperm washing. Cryopreservation of the surgically extracted sperm. The surgically sperms extracted is an alternative surgery for the male who cannot ejaculate and have the no viable sperm of the severe oligozoospermia in the ejaculation. So in these cases, you will cryopreserve the sperm by surgically extraction. So 50% of the cases of the male infertility are the idiopathic, are unexplained, and the therapeutic intervention is primarily by the assisted reproductive technique. So, according to the Trogue article, the lifestyle modification is also affect the male fertility. We already discussed in the NICE guideline, but in the Trogue article, there is some changes. We discuss it. Obesity affect the when the BMI is more than the 30, it affect the fertility of the male oligozoospermia and the azoospermia compared with the men who have the normal weight. Diet, the vegetable improve the semen quality and the sperm quality, but the processed milk and the full dairy milk, it reduces semen quality. Vitamin in the antioxidant, it protected the cell from the oxidative stress. So antioxidant is improve the semen quality, otherwise the oxidative stress causes the sperm dysfunctions and causing the sperm DNA damage. Smoking also reduce the sperm quality by reducing the number, motility and the morphology, and it increase the risk of the miscarriage. Alcohol also affect the semen quality. Caffeine also affect the semen quality by doing the sperm aneuploidy or the DNA break. Stress increase the corticosteroid level that decrease the testosterone, and that's why it affect the fertility. Sleep also because of the testosterone secretion follow the diurnal pattern, so the testosterone rise in the rapid eye movement sleep. So sleep is also very important. Prolactin secretion also increase during the sleep. Okay, so standard method of the sperm selection in the AR technique, that is the density gradient centrifugation or SWIMAP. Various advanced sperm selection technique, कैसे हम स्पर्म को सिलेक्ट करते हैं बाय दी यू कैन रिमेंबर दिस द मोटाइल स्पर्म ऑर्गेनल मार्फोलॉजी इवोल्यूशंस it including the 6 organelle to be assessed for the sperm selection, that is the acrosome, post acrosomal laminae, neck, tail, mitochondria and nucleus. Okay, so how will you select the sperm for the ICSI? By doing the hyposmotic swelling test or a magnetic activating cell sorting. Most common inapplied in the is the Klinefelter syndrome 47XXY, in which the 11% is azoospermia. So that's all about the male infertility in the Trogue article.